This video is an ethical and legal request for your informed consent before undergoing the medical procedure called esophagogastroduodenoscopy, or EGD, along with a colonoscopy. Your physician wants you to understand why the procedure is needed, how it will be performed, and will explain potential risks, complications, and benefits associated with the procedure as well as reasonable alternatives. To help you better understand the EGD and the colonoscopy, let's start by looking at the body's digestive system. The digestive system is also known as the gastrointestinal tract, GI tract for short. The GI tract includes the mouth, throat, esophagus, stomach, small bowel, and large bowel. The upper GI tract is the part of the system that begins at the esophagus and ends at the upper part of the small intestine called the duodenum. The lower GI tract extends from the upper portion to the lower portion of the colon that ends at the rectum or the sigmoid to the cecum. This is an endoscope. It enables doctors to closely examine the lower GI tract lining on a video monitor. This is a colonoscope. Both scopes have a camera that's guided with a set of hand controls with precise movements. Small openings allow instruments, air, and light to pass through. Using these scopes, your doctor is able to look inside the body's digestive system to examine the internal lining of the GI tract. The endoscope will be inserted into your mouth and guided through the upper GI tract. Your doctor will examine your esophagus, stomach, and duodenum on a monitor as the scope is advanced. The colonoscope is inserted and guided around the curves of your bowel to the end of the colon. During each procedure, your doctor may pause occasionally to inflate certain areas with air for a clearer view. The most common reasons for an EGD include, but are not limited to, heartburn, nausea, chest or abdominal pain, anemia, bloody stool, vomiting, trouble swallowing, suspected internal bleeding, abnormalities from other GI tests, or for the removal of a foreign object. The sources of these symptoms may include ulcers, inflammation, stricture, tumors or cancer, varices, polyps, usually harmless tissue growth, but sometimes precancerous, hiatal hernia, which may cause reflux symptoms. The most common reasons for colonoscopy include, but are not limited to, screening to find and prevent colon cancer, bleeding, traces of blood in stool, bowel dysfunction, abnormalities from other GI tests, checkups from previously diagnosed conditions, a family history of polyps or cancer. Detection and removal of polyps is the most common reason for colonoscopy. Polyps are usually harmless tissue growths, but can sometimes be precancerous. Other findings can include colitis, tumors, diverticulosis, vascular malformations, and ulcers. Prior to and during the exam, your doctor may give you intravenous medications to reduce anxiety and to provide sedation. These medications might make it difficult for you to remember the exam. Some of the risks of sedation include depression of reflexes, decreased breathing, and decreased blood pressure. Side effects and complications are rare but can occur during or after the procedure. EGD rarely causes discomfort. To ease the endoscope's insertion, a mouthguard will be placed between your teeth and sometimes a local anesthetic sprayed into your throat. The spray may have an unpleasant taste and make your tongue and throat feel swollen or numb. Colonoscopy can cause some discomfort. You may feel uncomfortable when the colonoscope is inserted or navigated through your intestines. Gas or cramping may occur as air is used to inflate certain areas for better viewing. If you've given prior consent, your doctor may treat any abnormalities seen during the exam. If stricture or narrowing of the esophagus is present, a dilator could be used to stretch the area. Samples of tissues, digestive fluid samples, biopsies, or cultures may be taken during the exam. If indicated, a small acid monitor, a Bravo capsule, may be placed to measure acid in the esophagus. If a polyp is discovered, your doctor may remove it using a snare or biopsy forceps inserted through the endoscope or colonoscope. Because your GI tract can be seen so clearly, doctors can determine if further testing will be needed and develop a treatment plan for your diagnosed condition. The EGD and colonoscopy procedures are usually safe and associated with very low risk. However, you should be aware of some of the possible risks. Risks include pain and discomfort, loss of teeth, hoarseness, a tear or perforation of the colon or rectal wall, a tear or perforation of esophagus, stomach, or intestinal wall, bleeding from scope trauma, dilation, biopsy, or polyp removal, cardiac or respiratory complications, reactions to medications, infection, irritation or phlebitis at the IV site, possibility of missing a lesion or cancer, and other risks specific to your physical and medical condition as discussed with you by your doctor. Extremely rare risks include death, brain damage, disfiguring scars, paralysis, loss of function of organ or limb. Because the digestive tract can be examined directly, most doctors consider the results to be the most cost-effective and accurate diagnostic procedure with the least risk. There are alternatives to EGD and colonoscopy, such as barium X-rays and scans, virtual colonoscopy with a CT scan, blood vessel X-rays, nuclear scans, laparoscopy, open abdominal surgery. The decision to undergo EGD and colonoscopy is yours and should be based on your doctor's evaluation of your particular problem as discussed with you. Colonoscopy and EGD are not perfect procedures and rarely lesions can be missed, as with any type of evaluation. If you decide not to have this procedure, be aware your doctor may not be able to properly diagnose or treat your condition, which could worsen or, in the event of cancer, possibly spread. If you have any questions about your need for this procedure or about the procedure itself, ask your doctor. This video can be helpful in your right to informed consent of EGD and colonoscopy, but should not be considered a substitute for discussion with your doctor.